being able to get the services that we really need. When they are absolutely desperate, they go to the doctor and say they really need some help. They need to see someone, but they are put on a waiting list or a referral or a letter, and they're not getting it. My friend said to me, Tamana, I am struggling. I need to see someone. And I gave him all these options: see a counsellor, see a psychologist, go to university. And he said to me, no, they're not helping. I said, what's happening with your appointments? Sorry, I'm still on a waiting list. I can't get one. I've been on a waiting list for over 6 months. You know, this week, he committed suicide. So I'm fed up of seeing young people, and especially young men. You know, there's a real increase in young men committing suicide. I want to know what you guys here are actually going to do about it, because I don't want to see any more of my friends on Facebook saying, I'm sorry, I'm not here anymore.
Emma Reynolds,
well,
what would you have done?
I think the NHS and mental health service are under great strain, and I think it's a real shame that Hannah had to wait so long to get treatment. And actually, you know, we've had Norman and Paul talk for the coalition parties. They've got warm words to say about this, but I'm afraid their record doesn't match those words. We've seen mental health services under pressure. We've seen the NHS more generally under pressure, waiting times going up, people waiting longer in A&E. I think our NHS is really close to being in severe crisis, and it's only the Labour Party that's got a real funded plan to make sure we have the staff that we need, that we have the training places. Somebody talked earlier very eloquently about working in the NHS and the lack of training places for nurses in the NHS. This government cut the training places for nurses in the NHS, and I really think that we need to make sure we invest in the NHS, but also this top-down reorganisation brought in, I'm afraid, Norman, I know you talk about these issues, and you're a minister in the department, but the Liberal Democrats backed the top-down reorganisation of the NHS that nobody voted for and nobody asked for, and frankly the NHS would have been under pressure anyway, but your government has put the NHS even more pressure.
Why was it in the last decade, when Labour were in power and you introduced maximum waiting times to get treatment, why did you leave out mental health?
Exactly.
It's a discrimination at the heart of the NHS. Why did you do it?
From the government that said that we should get rid of waiting times altogether. No. I mean, we had record levels of satisfaction in the NHS when we left power. I agree with you.
Why did you leave out mental health?
We should. I agree with you. Well, I wasn't a member of the last government, but I agree with you. We should have parity of esteem, and I've said that I do think across the parties people talk very eloquently about this issue, but we haven't seen action yet in order to address the issues.
I don't think we've seen an answer to the question either, Emma, that Norman asked you. But
well, we need to focus on mental health services, but we also need to make sure.
That's not an answer to that question. Let's move on.
Hello.
Well, we've got NHS staff and NHS patients with us here live in Birmingham. Let's hear from staff first, shall we?
Hello, I'm Harriet. I'm 24. I'm a maternity assistant, so I work on a maternity ward in Manchester. To be honest, I'm terrified what would happen to the NHS if it was continued to be a Conservative government. It's too much privatisation, and the NHS is free for everybody. I don't believe that because you have more money, you should be able to access services quicker or better services.
OK. Paul Uppal. We hear a lot of statistics touted about the NHS, but there's a real live member of NHS staff next to you saying that she's terrified.
Well, what I'd say to Harry, I have a lot of my own members of family who work in the NHS. And these stats we have about privatisation, it's gone from, I think, a 1 percentage point. What we're trying to do is make sure that everybody in this room tonight has an NHS which is free at the point of use. And what we're trying to do is more with the money that's provided. And the only way you're going to have that for the future and for your children is to make sure you have a strong economy, and that's going to be crucial for the future of the NHS.
Does that allay your fears at all?
I don't know that.
Turn into the mic if you
Sorry,
want.
I just still don't agree with privatisation. I think the money should come from different. I think you're saying that it needs to be a good welfare state.
If you want to know what's best for the NHS, you should ask the staff, shouldn't you?
Well, we do, and regularly do, and I do. With my own extent, in fact, regularly have this conversation.
You can do it now. She's right next to you.
Well, she does, and I do. OK. For the lot, in terms of funding for the NHS, since 2010, The stats are, the real stats are, it's gone from 100 billion to 113 billion, 9,000 extra doctors, 7,000 extra nurses, 2,500 extra midwives, and 7,000 less administrators. That's trying to do more with less.
But why are staffing issues? Why are there still staffing issues? There aren't enough staff in our hospitals. There, you know, and we're all overworked. We have to work extra hours, and you know, people are coming off sick because they're too overworked, overstressed.
You know,
and then you're having to pay them sick leave, and then paying agency staff to cover them, and it's just I don't.
Look, I agree, Harry. It's not perfect. 10 years ago, I spent 12 hours in A&E with my grandmother the day before she passed away. There was more money going into the NHS at that point than at any other point. It's not just about money, it's about making sure we get the right provision for the 21st century.
But we do need the extra investment in the NHS, and all of the experts say that by 2020 we'll need at least an extra 8 billion a year. Now, the Lib Dems have committed that, and we've shown where the money will come from. We're the only party that's done that. We need to change the way we do things to ensure that we are better at keeping people out of hospital, to stop crises from occurring in the first place, but it needs extra money, and the pressure on the system is growing ever greater. Well, I agree with that, and I want to clamp down far more on companies not paying tax. Actually, we've brought in more money from tax avoidance and tax evasion than in the previous government, but we need to go further. You're absolutely right.
But it's not the panacea, is it?
OK, let's hear from this lady over here.
Hi, my name's Emma and I'm 21. 3 years ago, I was diagnosed with ME, and my experience with the NHS was pretty poor. I had to wait months, up to half a year, for an actual diagnosis, and when I was diagnosed, every doctor I saw told me, nothing I can do, just going to have to stay as you are, you're never going to get better. I had to find a private clinic who specialised in recovery, and I strongly believe it is through their treatment I am recovering to this day. The next government needs to ensure that, regardless of what illness you have, all the treatments, the best treatment available, not only needs to be available in private clinics, we need it on the NHS.
Agree.
And we need it free to the people who need it.
Agree.
Hi, my name's Tom, and I'm a medical student here at the University of Birmingham. What I see is a lot of patients are getting lost in some of the systems within the NHS. So you can have the GP, you can have A&E, you can have oncologists, neurologists, different specialties, and they're being prescribed different treatments from some of them. And then you've got the health and social care, the nursing homes. There's a lot of fragmentation within the NHS.
Totally.
And I want to know what the parties are going to do about this, because a lot of patients are being lost in the process.
Well, we need to join up care around the needs of the individual patient far better. It's horribly fragmented, and often people fall through the gaps between different services. And it's ridiculous that we separated off mental health from physical health.
Absolutely.
You treat the whole person, not different parts of them, and it's ridiculous.
You're going to go further than that.
I'm Samara, I'm 18 and I'm from Luton. Nearly 2 years ago, I suffered from a stillborn, so I actually lost my child 2 years ago. And up till now, I still haven't received the results as to how I lost my son, and I've been chasing it. I'm a young girl, and I personally feel like I'm just a ball in the middle of a tennis court, and I've been thrown back and forth. I go to everywhere in the Luton and Dunstable Hospital to get answers, and up till now I still haven't received them. So I've lost a child and still not actually, and like it's been nearly 2 years, so my son will be 2 next month, and in that 2 years as well I've experienced a loss of another child. I've had a miscarriage, which wasn't so serious because I didn't have to give birth to that child, but it seems like a reoccurring thing. So for something so serious like that, I don't understand why I'm still being pushed to one side and stuff like that. I still haven't got the answers that I want, and also I've lost like 2 relatives from them being in the Luton and Dunstable Hospital. I've lost 2 relatives due to something that they've actually caught in the hospital and not what they've actually gone in there for. So I remember my grandma had a hip operation and ended up dying of something else. So like I need to understand.
Obviously, the hospital aren't here to defend themselves, so
but
it's
just
not fair for us to get
like
too much into it. But let's deal with your point. Let's deal with your point. Uppal, this must be hard to sit and listen to after a top-down reorganisation of the NHS. You've got patients telling you they feel shunted to one side, and staff telling you that the bureaucracy is causing chaos.
Well, look, I deeply sympathise, and, you know, it's heartbreaking to hear, obviously, the situation you're in. Look, it's not perfect, and obviously it needs to be, there's a lot of work to be done, but I think what we are is trying to make sure that we do maintain that NHS which is free at the point of... It's not free. We pay for it through our own taxes. And the crucial point is the long-term future of the NHS is going to be dependent on make sure we can actually provide that. So increasingly in a time when there's so much more demand for it as well.
But we need to do much better at supporting mothers, either where there's a stillbirth or a miscarriage, all those mothers who suffer from postnatal depression following birth. And good perinatal mental health services give a return on your investment. If you get those in place, as they are in some parts of the country, then mothers recover much quicker and then they can get on with their lives.
Okay.
We need to have that everywhere.
All right, Norman, thank you. Stephen Woolfe.
Well, I'm really sorry about that. I'm someone who's got a 2-year-old daughter, so I can only feel what you're I can't really feel what you're feeling other than my sympathy for you. But what I've looked at is I hope that there should be somebody listening to